Okay, can you hear me now? Please tell me that you can hear me now. Hi, Erica. I feel like it's working now, but please give me a signal that it's working, all right? That would be lovely. Sorry about that. I don't know what happened there to my microphone. Yes. Okay, lovely. Oh, whew. Thank you so much. So Brown is telling, can hear me, and Shital is here as well. So Shital did have a question. Phoebe is saying it's working. Okay, thank you so much, guys. Sorry about that. I'm not going to repeat all my introduction, but I do appreciate you guys obviously being here. And yeah, Wednesdays is kind of my little bit of a longer chat. Well, we're going to stick to half an hour to answer some questions. But if you don't follow me on Instagram yet, make sure you follow me on there. I kind of post kind of small tips and tricks for scoliosis and your yoga practice with scoliosis. So that's Jaureguiberry.scoliosis. If you don't follow me there yet, would be lovely to connect with you. And then make sure to check out all my videos on YouTube as well. So there's so many resources on here. And sometimes I know it can be a little bit overwhelming. So if you are new to this channel, make sure to check out the basics list. And it will kind of take you through some of the kind of the basic things that you need to know about scoliosis. I'm going to put my handle into the chat here, Phoebe, so you've got it. So there it is. So it's Jaureguiberry.scoliosis. Make sure to follow me on there. And I do have quite a few questions that have been submitted beforehand. But if you are here in the chat, obviously you've got priority as well. So I'm going to make sure to answer your questions as well. Good. So I'm going to start with Shital's question, if she's here. And where has it gone? And maybe, Shital, maybe you want to put it in the chat again. Nope. Trying not to get confused here. Maybe saying thank you. Good. Sorry, I lost it here for a second. Okay, where's it gone? So Shital wrote me a message, and she said, since the age of 15, she's got an S-shaped scoliosis, and it's an 85-degree scoliosis. Active enough, doing the required thing for it. So I would love to know, Shital, what you are doing already. But then she's saying, but the curve increased from 72 to 85 in a 5 years period, which is worrying me, giving the option for surgery. Okay, and then you're telling me here in the chat, so even after doing exercises for it, it's going to increase. And should I opt for surgery now? How will it affect me without surgery? I'm having many questions, but seems like I have shaken. Yeah, and I, I completely understand. And this is so difficult, right? And you're going to hear people weighing in, and effectively, this is obviously your choice, and it is your decision, of course. So you've been doing Iyengar yoga, belt therapy, and swimming. So with that type of curvature, so I would question, is 85, is that a Cobb angle? So I would just kind of question the measurement. This is a very large curvature, and I've had an interview with a lovely yoga teacher. Her name is Hend Walsh, who's got a similar curve. So I would imagine it's probably in that sort of arena as well. Now, the thing about those big curvatures, they are anything about 45 degrees is very much predicted to increase over time. That's just, statistics, and that's just from researchers having looked at lots and lots of different curves and how do they progress over time. And obviously, the higher the curvature is, the more kind of in competition you are with gravity at the end of the day. So the body has to work quite hard to make sure that you are upright all the time. So having said this, it doesn't mean that every single curve will progress. So there's so many things that we don't know basically about scoliosis. But what I'm saying is it is much more likely that it is going to progress, unfortunately. And the kind of the times when it's a little bit more tricky, or when they tend to progress, are pregnancy and menopause. So my next question would be, Shital, how old are you? And maybe those, because you were talking about this 5 years period of time where it did increase, I'm wondering if that could have also have something to do with hormonal changes as well. Also, having said this, so you did say from 72 to 85. Yeah, so that's a little bit more than 10 degrees. You do have to kind of take into consideration that there is always an error margin as well when they measure. So sometimes it's literally the way that you stand might be a little bit different from one day. It could be different in the morning to the evening. So I wouldn't get too kind of caught up on the exact degrees, but overall you will probably notice, I don't know if you notice that you're finding it more difficult to kind of be upright, to reset your curve. And I'm imagining, if you've been practicing Iyengar yoga, have you been practicing with a teacher who's addressing the scoliosis, or is it just general Iyengar yoga? But I would imagine you've got quite a good body awareness if you are already doing all these things and maybe noticing yourself, is it kind of getting worse or is it not getting worse? So obviously I cannot tell you what to do, and I do think you do have to speak to the surgeons, obviously, and get a couple of different opinions, obviously, on what to do. I always kind of would say surgery will always be there for you at the end of the day, right? So you might as well try everything else first, but sometimes it is the only option. So unfortunately, I wish yoga could fix everything, but unfortunately, sometimes it just doesn't work like that. And sometimes a surgery is necessary. Now, so Shital is saying she doesn't feel anything difficult. So if it doesn't cause you any problems, and really the surgery is mainly there to make sure that your vital organs, meaning the lungs and the heart, are protected. So I would speak to a surgeon, and it depends on where your curvature is exactly as well. So if it hasn't happened already, I'm just wondering if it is maybe not necessary, right? However, of course, if you see it increasing at a rapid rate, then yes, you will have to do something about it. But it's very, very difficult for me to say anything more without seeing you, of course. You can have a long and happy life with an 85-degree curvature, as long as it keeps stable. But of course, if it starts to increase, then that exercise might not be enough, or you might have to do a little bit more. So that is kind of my take on this. I don't know if this kind of answers your question. Probably not. It's probably gonna give you more questions. But it's a very, very personal thing, and nobody else at the end of the day can tell you what to do. We can all give you opinions, of course. But yeah, if it was me, I would get a few different opinions from surgeons, see what they say. Do you need surgery right now? They're probably going to say, well, you can wait a few years. You might as well wait a few years and see how it kind of develops over that time. And if you can start to get a little bit more specific with the exercises that you do to make sure your curve is stable and you don't go further into your rotation and into your scoliosis. So that would be my advice for this. So we've got Erica. Erica was saying she was just diagnosed. I'm 36 years old and never had any issues until 5 months ago. Okay, so tell us what the issues are, and we can see if maybe we can help you. So scoliosis, many times it doesn't cause any problems, right? And many times people again live long and happy lives, but sometimes you just have to kind of address the symptoms of it. So scoliosis doesn't mean in any way that your spine is inferior or it's broken or anything like that. It can still be very strong. You can still kind of you can be an athlete if you want. You can do all sorts of things. But sometimes, obviously, if it does start to create problems, then we have to do something about it. Okay, so Sheetal is saying, yes, almost. You answered many of my questions. I will drop my x-ray in your Instagram and take your opinion as well after speaking with the surgeon. Yes, and yeah, you can you can send me your x-ray, but that doesn't tell me a full story at all. So the x-ray is just bones, and in a way that's kind of left to the surgeon a little bit more on what is possible. They would see how much can of the scoliosis be corrected, but I would be much more interested in how you stand, how you move, how overall, how are you with are you strong to support that scoliosis? So, feel free, obviously, to, if you want to do a proper like assessment and go through everything, then you can book a one-to-one session with me and we can have a look at all of that in detail if you want. But yes, I would definitely speak to the surgeon. So you do want to ask about what is the risk, right? You want to ask about, so be very specific when you ask your questions, because surgeons, that's what they do surgery, right? That's their thing, they do surgery. But ask them exactly what is the risk if I don't have surgery, or what is the risk if I wait a little bit and don't have it straight away, because you're still young, you're 36. Okay, so Liz is saying craniosacral therapy helps me immensely. Yoga for scoliosis is also helpful. Jaureguiberry has lots of helpful videos. Thank you, Liz, for that shout out. Yes, absolutely. Do check out some of those videos as well. Again, if it's such a big curve, you do want to get really specific, obviously, and you want to make sure you are doing a practice which is targeted to you, and that sometimes just it's a few different tweaks of how you're holding yourself, because, and I've talked about this before, with scoliosis, we sometimes don't really know where we are in relationship to the space around us. That's called proprioception. So what feels straight for you might not be objectively straight at all, or aligned, or anything like that, but your brain has accepted this scoliotic pattern as a normal. So what you want to do with your movement practice is to get you out of this pattern and make sure you've got all the tools to reset, yeah, working in that way. Good. So Sheetal is saying, sure, we'll have one-to-one consultation with you sooner. Yeah, feel free to get in touch. No worries. Right. So while you guys here in the chat, if you do want to have any questions, I do have quite a few from Instagram, so I'm going to go through these. So Anisha is saying, can lumbar scoliosis, bone flexion be fixed or get to its normal bony alignment? So I'm not quite sure what you mean by bone flexion. But obviously I know what you mean by lumbar scoliosis. So my answer to that would be, we need to know what the cause, and I know we don't know exactly what the cause of scoliosis, idiopathic scoliosis is, but with lumbar scoliosis, the cause could, for example, be that one of your legs is shorter than the other, right? It could be that there's a hip problem. It could be that, and these are all examples of where it's maybe more of a functional scoliosis, functional meaning that it's more the muscles that are affected and pulling the spine over. Or is it actually an idiopathic scoliosis where the bones are slightly shaped differently to give you that scoliotic pattern? So obviously, if it's functional, if it's the muscles, there's much more we can do about it to correct this. If it's the bones that are affected, it's a little bit more limited. So we cannot actually change how the bones are shaped, and sometimes they are kind of literally shaped in a wedge kind of fashion to stack each other up. So unfortunately, there is not much we can do about it other than, keeping strong, making sure again that it doesn't get worse. So we need a little bit more information, unfortunately. And then we've got D Tiara is saying, I have scoliosis and hernia nucleus pulposus. What exercise fit me? Thank you. Good. So again, I would need a little bit more information about, for me to recommend something specific, obviously. But in general, scoliosis doesn't just come on its own usually. There's usually other things going on. So you might have scoliosis and osteoporosis. You might have scoliosis and arthritis. In this case, we've got a disc herniation as well. So when you are kind of working with someone, or when you're choosing your exercises, you want to get the whole picture. So it's not just scoliosis, but I would, if we were doing kind of a one-to-one assessment, I would ask you, all kinds of questions. What are kind of the main activities that you do during the day? Do you do a lot of sitting, or are you on your feet all day? Are you moving around quite a lot? What are your hobbies? What do you spend kind of long time? Obviously, if you're playing the violin, for example, or you're playing computer games all day, right? I don't know. But these are all things to consider when choosing the appropriate yoga poses or practices for you, because yoga at the end of the day is all about creating balance, and you want to create the balance first of all to whatever else you're doing in your life, and but then also just to be very specific and targeting it to what your body needs at the moment, and that is going to be different depending on what you do all day, on your age, right? Are you 22 and I don't know, you're maybe studying, you're at university, or are you 65 and you do a lot of gardening, right? So even though maybe those two people have a scoliosis and disc herniation, the exercises could be very different. That's one thing to say. For the herniation, herniated disc, again, I mean, I'm hearing it's in the lumbar spine. Very often, this has got something to do with people losing their lumbar curve, and I'm meaning the natural curve of the lower back. So I would be working on kind of bringing that back, that natural curve in the lower back, making sure we're not rounding too much into the lower back, and then strengthening up in this area. And the same really is true for lumbar scoliosis as well. So I would be looking at creating a bit more balance depending on how big the lumbar curve is, and then strengthening that area. Good, lovely. So Liz is saying meditation also helps me practice acceptance of my curvy imbalance. Our bodies are not broken. No, absolutely. I love that, Liz, and thank you so much for putting this in the chat. Yes, and I do want to highlight this really, absolutely, you can be super strong, you can achieve all sorts of things. People always ask me about, pregnancy and all of that. You can have 10 children if you want, right? You can be a, I don't know, professional whatever, weightlifter or anything like that, right? You can do anything. Um, but it's just knowing how to work with it, right? It's you've been given this body, you've got this body. We cannot change that in a way, but obviously what we can make sure is that you move at your best and you are the best version of yourself. I know this is a little bit overused, this term, but it's so true, right? So acceptance is absolutely a big part of it. And once we get out of this mindset of I need to fix it, right? It's always this word. I always get these questions of how do I fix it? You don't need to fix anything, right? You need to make sure you bring kind of the best out of what you've got. Lovely. So we've got Jonathan King here saying, hello, love your stuff. I'm 21 and pretty active, do a decent amount of back exercises and stretches. I'm on the short side and always been worried that I'll shrink. Hopefully not at 21. And then there's a follow-up here. How much do people with scoliosis normally shrink as they age? Male. Okay, so and I'm glad you saying male there in brackets. Now, generally, obviously, for women, this is much more of a problem because of the hormonal changes that we go through. For men, I don't know what the statistics are, but generally, as with the male body, you've got kind of a much better chance of not shrinking. But again, that kind of depends on what else is going on. Bone density is a big factor of this. But again, you do not have to worry about this until you're older than that. So all you can do at the moment is obviously make sure that you do your elongation and that you do your strengthening. So I've just posted on my Instagram some nice exercises or stretches you can do with your downward dog, adding a little bit of traction. So that is such a great thing to do. And with kind of losing height, it's very often it's coming from the lumbar spine. So that's another area kind of to make sure you don't sit for ages and ages, or if you do have to sit, get up, move around, reset, and do all that you can to kind of keep the height that you've got. And actually, in the beginning, when my microphone wasn't working, somebody said about being 6'1" and have scoliosis. Does height have something to do with scoliosis? I don't know is my answer. I don't know if there have been any studies of if height has something to do. Definitely there is a connection between hypermobility and scoliosis. Women have scoliosis more often than men. So 7-1 is the ratio. But I'm not sure about height, to be honest. So I'm gonna have to look this up. But I would imagine that being taller, it depends, right? But very often when you're really tall, you kind of make yourself smaller much as you can to kind of fit in. But that might not be true for everyone. If you're short, you probably do everything to be as tall as possible and to lengthen up. So that's something maybe to think about and to look out for. Okay, so we've got Erica saying, what things do you recommend that those with scoliosis should eat to help their bodies? Okay, so I'm not a nutritionist. I've had some back chats with people who are nutritionists though, so you might want to look back at those. But, I would look at diets, for osteoporosis as well. Making sure you get all your vitamin D, your calcium, magnesium, and all of that. So yeah, again, I cannot recommend anything here because I'm not qualified to do this, but there are some resources here on my YouTube channel, so you might want to have a look at those. Okay, Azzy is saying, hi, I'm 36, the third person to be 36 here. I will be 30, soon I will be 37. I have a 10-degree left lumbar and 24-degree right thoracic curve. Do you recommend chiropractic PT, or what exercise do you recommend? Thank you for everything. What do I recommend? I would... I think if you find a health professional, first of all, it's not so much what exactly they do. I think it's more if they are confident with dealing with people with scoliosis. A lot of them say they are, but they're not really. So yeah, I'm not a huge fan of chiropractic. Not to diss anyone here. I, for my body, prefer to go to an osteopath, but that's here in the UK, so it probably depends on your country as well, and kind of the education and the things they do. But again, you can get good ones and bad ones in all fields, really. So it's really important that you kind of find someone that you trust, and you might have to shop around a little bit, and you might have to try a few different ones. PT, again, make sure you find someone who knows about scoliosis, because the general ones, yes, they will know about scoliosis because they will have learned something about it during their education, but they probably haven't spent a huge amount of time in learning about it. And just bearing in mind that they are really generalists at the end of the day. So they help you if you've got a problem with your wrist, with your finger, with your foot, anything. So if you do want to get very specific, you need to find a scoliosis specific specialist. And in terms of exercises, obviously, again, it kind of depends exactly what you're looking to achieve, what are your goals, what else are you doing. We know how old you are, obviously. So yeah, for me at that age, it would be, depends on, have you got children, for example. What would you like to do? Do you want to run a marathon, or do you just want to be pain-free and move well? So really important to get clear on your goals. What exactly is it that you want to get out of the sessions, whatever it is that you're taking? So, and that will kind of give you some information of maybe which route to explore a little bit more. And if you do want to go down the exercise route, it's super important that you do something that you enjoy. So if you want to try out, the yoga practices and the way I teach, you've got a long list of videos on my YouTube channel. And for yours, so left lumbar, right thoracic, you could have a look at the S-curve scoliosis practices. You could have a look at the mild scoliosis practices. You could have a look at the right thoracic to a certain degree. But yeah, I would look at all the kind of the mild ones probably for you in this case. Good. Jonathan is saying, when I'm walking around or just existing and activating my core constantly to some degree, good to take some stress off the spine and back. Did I read this wrong? When I am walking around or just existing, is activating my core constantly to some degree good to take some stress off the spine and back? I'm going to say no to this. It might not be the answer that you expected. Activating the core constantly, and I'm not quite sure what you mean by that, but if that means kind of thinking about, I need to tighten my tummy all the time, I mean, listen to my voice, right? I cannot talk properly and I cannot breathe properly. So it's just something that is not sustainable for long periods of time. So you always want to match up the amount of core activation to the activity that you're doing, right? If you're just walking around, do you need to tighten your core? No. But if you're picking something up heavy from the floor, right, and you're working against gravity, and then yes, you do need to use your core, right? You need to get that support. So it always depends on the activity that you're doing, but also being mindful that what happens sometimes with people who think they need to activate their core and they need to protect their lower back because, oh my goodness, what would happen if they didn't? They would just fall apart. No, they wouldn't. What sometimes happen is that they tuck the tailbone. So, little example of this. I'm going to bring you up here. So hopefully that you can see. So if you're kind of getting yourself into this type of situation because you think I need to tighten my core and you're kind of losing your lumbar curve here and you're just kind of tightening and gripping the whole time, this is not protecting the back. This can actually cause more problems than anything else. So for example, you have a disc herniation, that's probably not the best way forwards, right? You want to create space as much as possible. What I would say, Jonathan, though, is do your core exercises and do all your strengthening, but then also work on your breathing, right? It's really, really important to have a core that, and what is the core, right? It's the deep abdominal muscles that can relax and that can activate. So a strong muscle can do both. It can contract when it needs to, and it can let go when it needs to. So that's really, really important. So a lot of kind of tightening and gripping all the time is not helpful, unfortunately. Let me know if that helps, Jonathan. Good. So Roman is saying, can a massage therapist help with scoliosis? Yes, absolutely. Absolutely, they can help. And they, ask them to target specific areas. And what a little tip here for scoliosis. So you might find that you've got a loud side and a quiet side. Right, what does that mean? So for example, let's imagine you've got one major curve, even if you have an S curve. Maybe there's one curve that is more pronounced. Maybe it's in the thoracic, maybe it's in the lumbar. But I bet that you've got one side which feels really tight. It feels maybe really bulky. It feels like the muscles are kind of hard and tensed all the time. And then the other side doesn't really feel like it's doing anything. So it feels maybe weak. Now, this doesn't mean that one side needs more strengthening than the other, by the way. But if you do go to a massage therapist, I would ask them to release some of that tightness, of course, on the convex side, usually. But I would also ask them to spend a little bit of time in their concave side that maybe feels good, or it feels like there's nothing there, because what's missing there is those connections to the brain, right? And that side might not be participating as much. So it's really, really good to give that a good kind of massage and get some sensations into that area. So that would be my recommendation here. Good. So I'm looking at some more questions here. Azi is saying, sounds good. We'll try your yoga exercises and videos. Yes, absolutely. Feel free to do that and just have a look at the playlists. If you are already quite a seasoned yogi and you understand your scoliosis, you know what you're doing, then feel free to join us in the membership, right? In the Shine membership, we've got a weekly practice with me live on Zoom. I can see you, you can see me. It's a group setting, so there's I can give you some pointers, obviously, and to get you into a more consistent practice. If you're brand new to this and you don't even know what your curve is, where to start on or anything, either you start with the basics playlist, which I mentioned, or maybe you just schedule a one-to-one session. It's 75 minutes where we go through everything. So we'll just have a kind of a full assessment. And then we start to kind of get into a yoga practice that is tailored for you, obviously, as well. Good. So there was another question which I really liked. So Rutu had quite a few questions here. So she's asking about can the mild scoliosis be treated by side planks? So we've got Dr. Lauren Fishman, who's an expert on this, next week. So make sure you tune in for that. And then she's asking, can we do Surya Namaskar if I have left lumbar mild scoliosis? So sun salutations, can you do that with left lumbar mild scoliosis? Yes, you can. Again, on my YouTube, you will find some adaptations for sun salutation. So there's just a few things to kind of to think about, and maybe focusing on, again, lengthening a little bit more than all the bending forwards and backwards. Good. So we've got another question. So I'm going to take one more question here. I don't want to keep you too long. As a teen with scoliosis and a slight scoliotic twist, would you recommend just staying strong and doing physio? I would say yes. Yes, generally, I think that's a good idea. Teen, how old? 13 or 18? Quite a big difference, of course. And yes, so sometimes, so if you've just been diagnosed with a mild scoliosis and they've said, well, you don't need a brace, you don't need any, you definitely don't need any surgery, then yes, just, and I'm saying this, just do what they say, but very often they're not very helpful and they don't tell you exactly what to do. So I do empathize with you. 17, okay. So you're probably not growing anymore. That's kind of what I wanted to establish. And then yes, in that case, I would just focus on finding something that you enjoy, some type of exercise, of course, where you can feel strong, keep moving, and then maybe educating yourself on your scoliosis and on your pattern. Again, if it's only very mild, you do not have to worry about this too much. But if you do find, oh, my hips are kind of really shifted over to one side, or if you're concerned about the appearance of it, if you can see it, then you might have to kind of look into it a little bit more and maybe understand where exactly your curve is going, and then starting to target your exercises a little bit more. But yes, overall, I would definitely do a lot of strengthening work. There's plenty of activities that you can do. I love yoga, and I think it's a great practice for those with scoliosis because it addresses those imbalances. But Pilates is good. So a lot of people who do rock climbing, for example. It's another great exercise for elongation and for lengthening. Swimming is great. There are plenty of things that you can do to stay strong. But yeah, sometimes you just need a little bit more. So it kind of depends on the situation. But hopefully that helps. Good, guys. So thank you so much. Sorry about the beginning of this. And yeah, I did have a problem with my microphone. If you missed obviously any of it, just maybe you start at like 5 minutes or so until I sorted my microphone problems. Make sure to tune in next week when we've got Dr. Lauren Fishman here, who's going to be talking about his latest research and side plank and all of this. And yes, really nice to chat to you guys, and see you soon. Bye, everyone.